So somebody asked about periodic alternating nystagmus, and it's exactly what it sounds like. It is periodic, which means it has a timing to it. It periodically reverses. It's alternating because it jerk beats one direction and then it slows down, does nothing, and then jerk beats the other direction. And it's a nystagmus because it has a fast phase and a slow phase. And that is the fast phase is what's alternating periodically in periodic alternating nystagmus. It can be congenital or it can be acquired. It localizes to the cerebellum or the posterior fossa, but it doesn't really localize any further than that. It just tells you something is there. It doesn't tell you what. It doesn't tell you the etiology. It can be demyelination, stroke, tumor. Doesn't really tell you anything other than where the problem is, not why the problem is. It's characterized by a jerk-beating horizontal nystagmus in one direction, for example, to the left, and then it slows down and develops a null where it's not doing anything, and then it starts going the other direction. So it's a periodic alternating nystagmus. The periodicity can range from 30 to 60 seconds. And what this means is you need to look at every patient who has a horizontal nystagmus and watch it for a full minute to make sure that it doesn't reverse direction. So if you see a jerk beating horizontal nystagmus to the right, you have to watch it, and then it'll slow down, do nothing, and then it'll jerk to the left. The apocryphal story is that the medical student goes in and writes down left jerk beating nystagmus. The resident goes in and writes right jerk beating nystagmus. The fellow comes in and says, you guys are both crazy. There's no nystagmus here at all. And then the faculty member comes in and demonstrates the left jerk beating, and they watch it become null and then jerk to the right. All the learners were correct, but they were also all incorrect. This is the defining feature of PAN. We're going to do an MRI to look at cerebellum, and it's one of the few nystagmus forms that responds to medical therapy, and the medicine that we use is baclofen. So you need to know about PAN.